You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people with gum disease. So if you have bleeding gums, bad breath, loose teeth, or you have been told you need a lot of your teeth extracted, you have to hear what my first guest has to say. He is an expert on the topic, one of the pioneers in laser dentistry, Dr. Brendan Dwyer. Dr. Dwyer, welcome to the program.
Good to see you, Randy. Glad to be here.
For people that don't know your practice, who's a typical patient? I guess Fort Myers, right? You guys are a healthy 50-plus community?
Exactly. It's a retirement area. Not everybody's retired, but most are.
Okay.
A lot of people come to us for cleanings. We do whitening. We do dentures. We do crowns. We do a lot of crowns.
Don't you do like the most attractive dentures in the world or something like that?
I think they're good-looking dentures. I think it's a
don't
very
you
good
have
product.
a name for them or something?
Cosmetic, lifelike dentures.
Is that right? Now, laser dentistry, because you told me, you're convinced if you would have got these people before they lost their teeth early on and used a laser to kill this bacterial infection, they wouldn't have to wear dentures. You believe that?
If it was gum disease.
Okay.
Because some of these patients lost their teeth from decay. There's been waves of tooth loss in dentistry.
So, what are the symptoms? Since we're talking about using lasers to treat gum disease, there's two ways, I guess, to do it: to cut it out, and I want to make sure I'm not exaggerating here,
Right.
And to deep clean it out, and you use a laser to like disinfect or kill this bacterial infection. Yes. So, what are the symptoms? How does somebody know?
Tender, bleeding gums, bad breath, loose teeth. Those are the main things. And not being able to eat your food.
Is that right?
When you go to a restaurant, you look at the menu and pick out things that you think you can eat. I had one gal who was out with a friend of hers, and she realized when her friend bit into an apple that she had gone too far. It was time for her to address her teeth. That was her call to action.
So her friend bit into the apple, and she realized she couldn't do that same thing.
She knew if she was there by herself, she wouldn't be able to bite into the apple.
Now, I want to mention for people watching this, it's a real interview, right? I'm not trying to side with you on this interview, and nobody's reading cue cards here, but I can't help but side with you. I met you 6 years ago, and since then I've met medical doctors and well-respected periodontists, the gum specialists, that love this laser. They say this is how things should be done. No more cutting, as you say, no more sewing. Does that happen in your town still?
Oh, yes.
Where they treat, like, what?
I think what the periodontists would say is they're cutting away the diseased tissue.
Okay.
I'd add on that they're probably cutting away some good tissue too.
Okay.
And then they're sewing.
What does that mean?
Well, they cut the tissue and they peel it back, kind of like you take the skin off an orange, and they reshape things and then lay the tissue back down. So you're kicking in all kinds of healing responses there that aren't that pleasant.
Okay. Now, let's talk a little bit about the way you treat gum disease. That means bleeding gums, bad breath, their teeth are getting loose, and how it's traditionally done. So what's the difference between doing it with a laser and doing it with the cutting? If you could dummy it down for us.
Usually when it's done surgically, cutting, the cut and sew method, let's refer to it that way, the patient starts off first with deep cleaning, which is cleaning while you're numb. And after that's done, then you're done, it's being done in quadrants. So you can end up, by the time
like
the
different sides of your mouth.
Right.
Okay.
Quadrant here, quadrant here, quadrant here, quadrant here. Some even have 6 quadrants in the mouth. One here, here, and here.
Okay.
Same on the lower. So it's quadrant surgery. So you can end up having 9, 10 appointments before the mouth is treated.
That's how they're doing it typically across the country. Is that correct?
I believe so, yes.
Okay. How are you doing it?
We're treating it as a full bacterial infection with the laser that targets the bacteria and all the pigmented things that the bacteria have to them. The tartar as well, the diseased gum tissue. And we're just going around the teeth. We're not peeling back any gum tissue. We're not removing good tissue. We're leaving it all intact.
But you're saving teeth, every day.
Oh, yes.
Every week in your practice.
Absolutely.
Teeth that would have been extracted, you're able to save these teeth.
Right.
But that's the part I'm not sure I get. Why is it you take loose teeth, the teeth are starting to move, they're bleeding. How does this laser make that stronger? That's the part
It gets
I'd like to know.
It gets the gum healthier, and then the gum can embrace the tooth.
Okay.
And when I say embrace, we want it up near the crown of the tooth, not down on the root.
So is that what's happening? So it's shifting down. The gums are getting away from the tooth? That's what makes them loose?
The part of the gum that adheres to the tooth is dropping down.
All right.
Because there is a part of the gum that adheres to the tooth, and that strengthens it.
You call that the attachment?
I know.
Okay.
And I'm trying not to use that word.
Okay. So the laser does what then?
It gets the gum tissue healthy. And we also get the root healthy. We create the environment for a healthy attachment. There we go.
Okay, good.
I'm using the word again.
All right. So how soon? So for example, typical patient comes in. Because you say that you're the last resort guy
I
sometimes.
saw a gal the other day. She came to us for a second opinion because she'd gone to another dental office. She was told she was going to lose her teeth. They did impressions, and the case was in the lab. They were starting to make her dentures.
Okay.
She wanted a second opinion. She was in her mid-50s, and she just thought she was too young to be losing her teeth. I agreed with her. She did have all the symptoms of gum disease. She had the red, painful tissue. She had bleeding, and she had loose teeth. And she was limited on what she could eat.
Okay.
I a lot of times don't find that out until after we get it where the patient can eat what they want. Then they'll say, now I can eat what I want. So we treated Erin's mouth with the laser, got everything nice and healthy. After we were done with that, she said, okay, now what about these spaces and gaps? So we ended up doing really aesthetic crowns on her and really improved her smile to the point where she says that she gives her smile credit for her increased tips at her job at the dog track.
Is that right?
Yeah, she has a part-time job there, and she said her tips are much better. And she's got a great smile now.
So this is a big problem. I mean, where you live, I guess across the country, but would you say there's tens of thousands of people within 1 hour of your practice with bleeding gums, bad breath, loose teeth, or their teeth are
Right.
about to fall out that you can help with the laser?
Right. Yes, we can. The thing about this disease is it doesn't hurt until you're basically going to lose your teeth. Even those people, quite often we can help them hold on to their teeth, or at least enough to keep them chewing.
Is that right? Okay, now we're going to take a quick break. We come back. You have some photos that
Yes.
you brought of samples of how you clean up their mouths and give them a beautiful smile.
Yes.
How important is a smile, in your opinion?
Oh, it's very important. I think, well, any motivational people tell you that the smile is the key way. Because when you talk to somebody, you're either looking at their eyes or their teeth.
Okay.
And the teeth say a lot. They can show, well, white teeth.
Yeah.
White teeth is good because they say that's better than losing weight to improve your appearance.
And we got to go to the break, but when somebody's flossing, you're saying if they're bleeding, and I don't want to put words in your mouth, they have a bacterial infection.
Correct.
Chances are.
One thing, when you're showing the floss and going back and forth, patients do that too. You don't want to go back and forth with your floss. You want to go up and down.
Is that right?
Yeah, back and
Okay.
forth is sawing. And that can disrupt the attachment.
Okay. Now we're going to take a quick break.
Right.
And we'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We'll be right back.
I think the biggest difference is for years I'd gone really not wanting to smile, hiding my teeth when I smiled, and it gave me back that I could smile with confidence now.
I'm in business. I talk to a lot of people with the confidence of knowing that I can smile, I can talk, and that people aren't necessarily looking at my teeth or my gums or for something unsightly. I just have a lot more confidence. I feel a lot better about myself. I feel healthier and better state of life.
I feel like I have a new mouth. It was the best thing I ever did. In fact, I told Dr. Dwyer today that my mouth feels better now than it probably did 30 years ago before I even had the major problems. So I would recommend, anybody that has, gum disease like I had to do this treatment, and you will be amazed.
You're watching The Wellness Hour. I'm Randy Alvarez. We're talking about gum disease. According to my first guest, no more bleeding gums, no more bad breath, no more loose teeth. And for those of you that have been told you may have to lose your teeth, he says you may want to get a second opinion. We're talking about laser dentistry today with one of the pioneers in laser dentistry, Dr. Brendan Dwyer. Okay, so Dr. Dwyer, you brought some photos.
Yes, I did.
And so what are we looking at here?
Okay, this is Noreen. She's a typical patient with gum disease. She's got bleeding gums, tender gums, she's got bad breath, and she's got teeth that are loose. So she has to watch what she eats.
Okay.
Now, she was going to a dentist that told her, you can go to a periodontist, but people that go to the periodontist don't like the side effects or the healing.
Surgery.
The post-operative
Okay.
complications.
Okay.
And so she was discouraged from going to the periodontist. Well, ultimately, the disease process percolated up, and it was in her upper right area. She was swollen, painful. She was referred to the oral surgeon. This is a picture of Noreen when I first met her.
Okay, so she has a bacterial infection.
Right.
So I'm following this story.
Right.
Okay. What is that thing at the top left?
That's
Pretty gruesome here.
That's a surgical drain. That was placed
Okay.
by the oral surgeons. So Noreen was sent home from the oral surgeon saying, when this calms down, we're going to go ahead and take these teeth out.
Okay.
Noreen saw our flyer out of the newspaper, and she called. Not only does she still have those teeth, but we ended up restoring those teeth. You know, this
What do
is-
you mean restoring those teeth?
These are all ceramic restorations. That's what she looked like afterwards.
Very nice.
No more dark triangles, no more spaces. She had one tooth, this one over here, that was on what's commonly referred to as a flipper, which meant it came in and out of her mouth. So when she was eating, not only did she have to keep track of her food, she had to keep track of this appliance. So Noreen thought she was going to end up with a good-looking set of dentures. What she ended up with instead is a good smile. And Randy, she's got a great story on our website. If you go to where the patient reviews are, she's the first one in the first row. She's got a
Like,
great
what does she
story.
say that stands out in your mind?
Well, she said that she had been treated with conventional gum surgery before. And she said it came back.
Meaning the bacterial infection came back.
Right.
Okay.
And that's an interesting thing. And she'll say on the website, now it's gone. It's under control. You know, we do see her regularly for cleanings, but she's got, gums that don't bleed, her teeth are tight, and she'll tell you that she can eat whatever she wants in the menu. She doesn't have to pick things that she knows she can eat.
So do you think a lot of people think, hey, my gums are too bad for veneers, or my gums are too bad to do anything? I mean, she was headed for, and I'm a little skeptical, but this is a person you're saying was told elsewhere, all of your teeth have to come out.
I
And
don't
you're
know.
saying that with the laser, you not only saved the teeth, you were able to, give her like a smile makeover.
Yeah, I think she was left with the way, eventually you're going to lose your teeth.
Okay.
I don't think they were, it's going to be one day where they just fall out. But, she gives such a positive review. Like she was saying, there's no substitute for self-esteem. She's confident in her smile now.
Let's go to that video. You brought some videos here and hear what she had to say about this laser treatment to save her teeth. You're watching The Wellness Hour with Randy Alvarez. Let's take a look.
You can't put a price tag on self-esteem, and that's a biggie. But the other part is I don't even have to think about what I eat anymore.
Oh, very good.
I don't have to worry about losing teeth.
And I love it. I've never had to deal with adhesives or anything. It fits perfectly. I love it. I wish I'd have done it 10 years ago. I can eat again. I can eat anything I want. I mean, I even ate an apple the other day. I mean, I can't bite forward, but I mean, I eat everything they say people can't eat with dentures. I have no problem.
Good.
None at all. And I love my smile. People compliment me on my smile. And I have both of my children coming here now. So that tells you how comfortable I am.
People that have known me for years, I sit and talk to them now, and they go, they're trying to look at my mouth. What's different about you?
Right.
Well, I used to have a mustache and facial hair, shaved that off. And that's what I tell them. I took my mustache off. They said, geez, they don't budge. Matter of fact, I have to be very patient taking them out without causing any injury to myself. Because they're in there for a long time, and they fit perfect.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about new treatment options for people with bleeding gums, loose teeth, and for people that have been told their teeth have to go. And maybe they don't have, according to my first guest, or Dr. Dwyer, maybe they don't have money for a full mouth of dental implants or something like that. He said it's worth a consultation to see your options. Okay, so elaborate on what I just said.
A lot of people that have the disease do feel that dental implants is the route that they're going to end up having to go.
Because I know you're a fan of dental implants.
I'm a fan
They're
of
good.
them.
Yeah.
But I don't think they're the only answer.
Okay.
I look at teeth as natural implants. we know they're going to stay in the mouth, or they've got the best chance.
But there are certain cases. I mean, for your denture wearers, you like dental implants to secure a denture.
Oh, yes.
Okay.
They can get back to having secure teeth they can count on.
Now, I had a dentist on my show, and we were talking about this topic about lasers. And he said it drives him crazy. He says he sees national shows, and everybody's talking about flossing and brushing for this bacterial infection, because you can't really brush out a bacterial infection. You got to treat the infection. And he said that the laser treats the cause.
Right.
Does it frustrate you too that there's not enough mention of, the treating this bacterial infection?
Randy, when I see these patients where they've got the red bleeding gums that are tender, they know they've got bad breath, they've got loose teeth that limit what they can eat, and we've got good options. This laser can target the disease, and I think it can do it most effectively and quickly. We can get the mouth within a month feeling so much better.
Now, like this lady right here, okay. And I like what you had to say, that, here's a woman that didn't really smile a whole lot, and now she has a beautiful smile because of your laser. So it's more than just killing this disease.
Right. No, it is more than killing the disease. It's just addressing the whole mouth. The patients, they want to have confidence in the dentist. So once you get the mouth healthy, they have your confidence, or you have their confidence, and they allow you to go ahead and get things in tip-top shape.
Now, you guys wear these buttons. No
Yes.
cut or something? Or what is it?
No cut, no sew, no fear. And it's got the circle with the red line across the scalpel blade.
And what that means is what?
That means it's still being done. Every day in my town, people with gum disease, pocket elimination surgery, being done with the scalpel, and then there's being sewn up afterwards. We're able to not do that. We're able to use the laser, just easily go around the tooth, and it's virtually pain-free.
Okay.
Patients, I call them that night to see how they're doing.
You do?
And, the ibuprofen usually takes care of it. I've got one patient in the stack here, David.
Show me. Let's take a look at that.
Well, it's more a story.
Okay. All right.
David came in 2 years ago. So he's missing 2 teeth down here. I see he has gum disease. And I've come to find out he knew he had gum disease before.
Okay.
But he had started off getting it treated. He had 1 quadrant done, and he figured he'd live with the disease. He didn't want to take the steps necessary to correct it. So this time when he was in, he'd broken off 2 teeth. One was a hopeless tooth. Another, we put a large filling in there. We're going to do something down the road. I said, we really should address your gum disease before we do something like crowns. And I said, there's a different approach now. And I let him listen to a testimonial that was on our website. I talked to him about it. And he says, okay, if I do this, and it's as good as you say, I'll give you a testimonial. And again, when we do this in 2 appointments. David came in after the first appointment to do the second appointment. And
So you go around the mouth with a laser.
Yep, half the mouth. He came into the door. He says, I can't believe what an experience it was. He said, it was nothing like before. He said, this is so much better. So he said to me, let's do the testimonial.
Is that right?
Yeah.
So I'm clear, and we're talking about gum disease today. There's 2 ways to do it for this pocket reduction surgery, where you go to you go to a specialist and they cut some of the diseased tissue.
Right.
They peel back the gums. They oftentimes have to stitch up the gums, very sore. They do one part of the mouth at a time to get rid of the infection. They give them an antibiotic. Is that right?
Correct.
You also may give an antibiotic. Is that right? For
Correct.
like 10 days. But other than cutting it out, like you said, removal by amputation is, I think you said ridiculous, but you go around the mouth, kill this bacterial infection with a laser. The teeth get stronger. I also want to make sure I have this right, because the gums kind of hug the tooth again, and the bone kind of, a little bit of bone regenerates.
Right.
And you save teeth.
That's the important
I mean,
part.
is it really?
Yep.
It sounds obvious to me that this is how everyone should treat this.
This is an example of the cut and sew surgery.
The surgery, okay.
You can see the dark triangles
It's terrible.
between the
But what
teeth.
am I looking at?
You're looking at lower teeth, and to get the infection under control, they cut away the gums and lowered it down.
Oh, interesting.
So there's more tooth exposed, As you can see
So
there, you can
if
see the
you do
root.
the cutting style, you're left with a little bit less gum.
Correct.
Interesting. Interesting.
A lot more tooth. As the expression says, long in the tooth.
Yeah, I mean, look, anticipating this interview, I've talked to periodontists, well-respected guys that head up programs, and they say, I don't do this type of surgery anymore.
Right.
And they say, but some of my colleagues are still skeptical. Not enough science with this laser. What is your response to
There
that?
is science. That's why when I bought this laser, it had Food and Drug Administration clearance, because there's a study that shows hopeless teeth can be saved.
So you brought a video of the laser. It's an animation. What are we about to look at? What is it?
You're going to see the laser doing its job.
Okay.
It's pretty straightforward.
All right, let's take a look.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
Now, is that a little bit oversimplified? Or is that pretty much how it is?
I think that's how it is. I think it helps the patient understand what's going on.
So after the laser treatment, people that had a tough time eating because they're sore or loose teeth, what's your best story of how soon somebody could eat?
I had one lady that we were 2 months after we treated her, and we had deep disease measurements that had cleared up. And we had good, healthy attachment of the tooth up high. And so we were able to start her restorative dentistry in 2 months.
Okay, good, good. Now, you were one of the first interviews that, I mean, you almost introduced me to the laser 11 years ago. Since then, my cousin, 50-year-old guy, he's told he has about 6 teeth that have to be extracted. We have a laser here in San Diego. Called the doctor, they did it. Now, he didn't tell me this, but he said within 3 weeks, he can eat. He says his teeth are like solid as a rock. So is this common, this kind of a thing? And I'm not trying to side with you on this, but maybe he's exaggerating, but
no,
his wife said his bad breath went away completely, like in a week.
It's common. It's not unusual. The more I do this, it also depends how many teeth you have. The gal that I was talking about, she only had 6 teeth.
Okay.
But if you get a full complement of teeth, and you get some teeth that are strong and some that aren't, there's ways around that to compensate for the weak teeth till they get strong.
Okay, good, good. So you brought another photo, and then we're out of time. What do you got?
Okay. This is Erin. This is the gal that I was talking about that was told she was going to need dentures.
Let's take a look at that.
This is what she looked like before. Now, that's not a real natural smile, I don't think. Because when I'm looking here, I can see more of her lower teeth than the upper. One thing that I think...
She's kind of grimacing.
Yes. I think what she's working around, this is a
my
retracted view. I know, we won't look at it long, but you can see the dark spaces between the teeth.
All right.
This is what Erin looks like afterwards.
Wow, very nice.
Her symptoms were, she went to another dental office and they're making her dentures.
Really?
Yeah. What she had were some loose teeth. She had some bleeding gums, some bad breath. When I told her that we can hold on to these teeth, she was pleased. I mean, she called the other office. She did get her money back.
Wasn't she hard to believe? I mean, wasn't it hard for her to believe?
I think she was optimistic in herself.
Oh, really?
Yeah.
So she actually paid to have a denture being made.
Right.
She walks into your office, you laser her mouth, the teeth get stronger.
Correct.
Is that right?
Yep.
Because the laser stimulates the gums kind of to hug the teeth.
Right.
And now she has her own teeth. And then you must have put some veneers or something on there.
All ceramic restorations. That's the trick. Those are the most natural looking. And she's got the smile that she wants and deserves. And it stays in all the time. She thought she was going to lose her teeth. We've addressed that.
Yeah.
We got things stabilized. She can eat her food. Now we've gone after the smile. Now she's got a smile she's proud of. I mean, she took Laura to meet some friends of hers. There were like 8 of them there. And Erin told her friends, Laura works at the dental office. And every one of the people at the table told Laura how much better Erin's smile was, how much more confidence she had in her talk. You know, and these are good friends.
So what do you say? Final message, we're out of time. Somebody watching this, and they have the symptoms, maybe a denture is being made, they know their teeth have to go, maybe they don't have enough money for dental implants. What do you tell them?
That there are very good options out there, very cost-effective options compared to a full mouth dental implant. And you get to hold on your own teeth. I mean, the older we get, the more you want to hang on to what you have.
And how old can you be to get this laser? Does it matter?
I've done it on patients in their 90s.
Is that right? And the teeth get stronger.
Yes.
So obviously, like anything else, early treatment is better and cheaper. Mm-hmm. So early, I mean, when should they see you? During that bleeding gum stage, loose teeth phase, flaring?
Any phase. You come in, let us evaluate it. The other important thing is your immune system can focus on something else.
Okay.
When you've got this infection in your mouth, the immune system is focused on that. So you could have something else happening in your body that isn't getting addressed. So I like to free up the immune system to focus on more important things, because we can fix this.
If it works, though?
Yes, it does work. And it's getting a lot more popularity now. Well, you know it. How many?
Yeah, I mean, I've talked to dentists. I mean, they believe in it. And you've done a great job at really, I've definitely learned a few things today. Mm-hmm. And so if you have those symptoms, and some people don't have symptoms, right, you say?
Or they're not aware of them.
They're not aware of the symptoms. But for sure, bleeding gums, bad breath, loose teeth.
Right.
If it hurts when you chew.
Yeah, that's
come in.
The big thing. If you've got to watch what you eat. If you
insurance doesn't cover this for the most part. Or if insurance covers the surgery, will it cover this?
Correct, it does.
Okay, good. Or at least a portion of it.
Correct.
All right. I want to thank you for coming on the show.
Okay.
Always a pleasure to have you on the program. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again, just go to his website. We'll give you a clip to put on your website, and they can view it again. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.